To kick off today's program, I'm pleased to welcome Cindy Long, Administrator of USDA's Food and Nutrition Service. Administrator Long presided over a $225 billion budget in 2023. I asked her about that when she came in today. I was like, is that right? It makes me kind of anxious just to say that number. So I can imagine what it's like to be responsible for administering that. But you have her bio in the packet. Some highlights, she served as Deputy Administrator of the FNS Child Nutrition Programs before taking over as Director, and she was responsible for transforming the National School Lunch Program and other child nutrition programs in response to the pandemic. She's one of the chief architects of implementing the Healthy Hunger-Free Kids Act, and now she's got. We're going to hear about her vision for the Food and Nutrition Service's Healthy Meals Incentives Program and what they're doing to really revolutionize how meals are served in schools. So help me in welcoming Administrator Long. Thank you for being here.
All right, well, good morning, everybody. Thank you, Thomas, for that introduction. It's great to be here on this admittedly somewhat dreary day in Washington. It's really an honor to be here kicking off the second day of this conference. I know I've attended this conference a number of times over the past several years, and I know that it's always like an energizing event because it brings together folks who are really attuned to the interests and the needs of consumers when it comes to food and nutrition. So thank you to CFA for convening this group today, and thank you all for the leadership that you and the organizations that many of you represent provide in this space. USDA's Food and Nutrition Service, of course, shares the goal of safeguarding the country's health and nutrition. We operate 16 domestic nutrition assistance programs that serve 1 in 4 Americans on any given day. I'm here to give you kind of a brief update on what's going on in our programs, but I want to start with the goals and the principles that we see them as rooted in. Under the Biden-Harris administration, we are committed to building a healthier future for all Americans. We see that as a future where all Americans are nutrition secure, which means they have consistent access to healthy, safe, and affordable food that's essential for health and well-being, and that is true no matter who you are or where you live. As many of you undoubtedly know, early in the administration, the White House hosted the first conference on hunger, nutrition, and health that had occurred in 50 years. That was a landmark. As I suspect that everyone in this room knows, poor nutrition is the leading cause of illness in the United States. It's associated with more than 500,000 deaths a year. It's linked with chronic diseases like obesity, diabetes, and heart disease, as well as broader societal impacts. We also know that around 85%, by some estimates, of current healthcare spending can be attributable to diet-related chronic disease management. At the same time, far too many Americans continue to struggle with food insecurity. The latest data show that 13%, or nearly 17 million of our fellow Americans, struggle with food insecurity. And we know that is particularly prevalent in underserved communities. These are real issues, and at USDA, we are committed to making real progress in responding to these urgent challenges. So today I want to highlight what some of the things that we've been doing in our domestic nutrition assistance programs to address these. I want to start, though, before getting into our programs, with a topic that I know is important to everyone interested in food and nutrition, and that's the dietary guidelines for Americans. They're a critical part of the component of the federal effort to improve health and nutrition and reduce the prevalence of diet-related disease. As you likely know, USDA and the Department of Health and Human Services work in partnership to update and release the dietary guidelines every 5 years. The current in-place version is the 2020 version. We were very pleased at USDA that for the first time the DGAs addressed nutrition for those from birth to the age of 2. We're also acknowledge that the process for the updating and creating the 2025 edition is well underway. As part of that process, HHS and USDA have committed to transparency, equity, and scientific integrity as foundational to that process. One of the important things to know about the 2025 DGA process is that the advisory committee is examining the relationship between diet and health across life stages, and that they will use a health equity lens in everything they do. So I want to also thank everyone who's here today who has engaged in the process so far, either by providing public comments or participating in one of the public meetings. There is a public meeting coming up in May that I hope you'll join. And I can't talk about the DGAs from USDA's perspective without also talking about MyPlate. We are launching a multi-channel effort starting this spring to start making MyPlate a household name. So we hope you'll join us in sharing the fantastic information and resources that's available around MyPlate. Would encourage you to share MyPlate content at our Instagram page and our Facebook page, which are both MyPlate_USDA, as well as at MyPlate at MyPlate on X. So, we're all in the social media world, so please help us lift that up. I'll also just briefly note that the DGAs are critical in informing the Thrifty Food Plan, which is as a critical underpinning of the benefit level in the SNAP program. Early on in the Biden-Harris administration, we reevaluated the TFP to reflect an updated, modern cost of achieving a healthy diet, as Congress directed us to. As a result, SNAP benefits increased by about 21% on average, putting healthy food closer in reach for millions of participants. We see that as a hugely important step in advancing nutrition security. So let me move on to a few more current or recent program updates. I don't have time to highlight all of the programs. There is a lot going on, but let me focus on those where we have very current news. And I'll start with WIC. There are two really major things to just celebrate at this moment, right? The first is that recently, as we finally came to an end of the 2024 budget process, Congress has fully funded the program at $7 billion. That is worth applause. Yes, thank you. It is. That is so important. Fully funding WIC has been a bipartisan consensus for decades, but this was a real struggle to get that funding over the line this year, and we want to really thank all of the partners and the voices who lifted up the importance of WIC. This frankly would not have happened without voices like yours. I also want to note that we are this year celebrating the 50th anniversary of the WIC program. So I think it's great just to pause and celebrate the fact that for 50 years, families have had access to the wonderful life-impacting benefits of the WIC program. At USDA, we're working hard on WIC. We are continuing the work we started a few years ago with funds from the American Rescue Plan to expand WIC's reach and to modernize the program. We'll be launching soon a national outreach campaign to try to connect more WIC eligibles with the WIC program, because the participation rate among eligibles is lower than you might think. We're also working to modernize how the program delivers benefits so we can meet families where they are with things like online shopping and even simple things like helping states use text messaging to communicate with their participants. Finally, we are very close, and I do mean very, very close, to finalizing the most recent updates to the WIC food packages. These updates are informed by the dietary guidelines and to reflect the latest current science, including those standards for infants and children up to age 2. The changes in the food package that you'll see very soon will provide participants with more flexibility, variety, and choice. And again, we think that this will put WIC in a good position going forward to continue its incredibly important role in supporting healthier futures for moms, infants, and young kids. So let me turn to school-age kids. Thomas mentioned that I have spent a fair amount of time in the child nutrition world in my career, and honestly, I can say I truly do believe we are at a potentially pivotal moment in child nutrition. School meals, in recent years, school meals have gotten more nutritious, more kids have access to them, and we're seeing some really significant innovation in the school meals market space. If you're not convinced that this maybe is a pivotal moment, let me tell you why I think that. We see a number of states adopting healthy school meals for all at the state level. I think we're up to 7 or 8 now, which means that every kid gets a school meal without a means test. These states are leading the way in showing us all that nutritious meals have to be seen as an integral part of the school day, not a separate side thing that happens over there. They are just as integral to a quality school day as books and computers. At USDA, we recently, in support of this movement, have made some regulatory changes to make it easier at the local and school level to provide healthy school meals for all. We don't have the ability to do it at the state level or the national level, but we do have some tools to nudge at the local level. We are also, similar to WIC, close to finalizing updates to the nutrition standards for school meals to help them, continuing on the trajectory of getting healthier all the time, including, really importantly, we have proposed for the first time limits on added sugar in school meals. And we are continuing proposing to continue on the path to gradual sodium reduction over time. And I want to note that because I know you heard from FDA Deputy Commissioner Jim Jones yesterday. We have really worked with the FDA on those rules, in particular as it relates to sodium. The gradual path we have proposed is very much aligned with the work they're doing around voluntary standards that will impact the entire marketplace. We also saw during COVID and post-COVID, really, the challenges that schools are very vulnerable when supply chains are disrupted, maybe more vulnerable in other sectors. So we're investing in innovation in the school food marketplace through something that we're calling our Healthy School Meals Incentive Initiative. That will fund projects that will support collaboration between food producers, suppliers, community partners, distributors, schools, to make the school food system work better for everyone. We've also launched, in collaboration with the Urban School Food Alliance, a project that is focusing specifically on how schools procure food, because we want to give schools every possible tool to be the most effective and efficient buyers and consumers that they possibly can so they can get the nutritious food they need. You're going to hear a lot more about the incredible opportunity in school meals on a panel a little bit later on this morning, which I'm sure is going to be both innovative and inspiring. So I'd urge you all to pay careful attention there. Now, I can't wrap up an update of our programs at USDA without mentioning the extraordinarily powerful set of programs we're going to be rolling out to serve kids in the summer. It doesn't feel like it today for sure, but summer is right around the corner, and it's a time that has traditionally been really challenging for kids. You've heard the phrase, hunger doesn't take a vacation. And many kids lose access to nutritious meals that they depend on day in and day out during the school year from their schools. So I'm really thrilled that we have a historic opportunity this year to add to the suite of tools that we have historically had to combat summer hunger. Historically, we have had a wonderful summer program that serves kids in group settings, whether it's a rec program, a church camp, a school-oriented program where kids come together and can have breakfast, lunch, and snack. This is a wonderful program for the kids it reaches, but historically it's struggled to reach all the kids that we know need the support. Only about 1 in 6 of eligibles have traditionally been able to participate. So we now have 2 new really important tools. One is a program expansion for rural areas that have traditionally been hard to reach with that coming together congregate program where providers can provide meals in a drop-off or even a delivery fashion, with the kind of thing that was allowed during COVID. We're also really excited that this summer, for the first time, we will have a national summer EBT program that will provide food dollars on a benefit card to families with eligible kids. So what that means is that they will have dollars to spend to help fill that gap during the summer. We really do expect this new suite to be a game changer. Summer EBT, which we're calling Sunbucks, by the way, we're calling all these programs the Sun programs. We expect it to reach 21 million kids in the states that are adopting in this first year, and we expect that more can be served going forward as more states adopt the program. And I want to note that I really do see these programs as having been catalyzed by the call to action that came out of the White House conference. And I'd also stress they passed Congress with bipartisan support. Now, I'm going to wrap up so we have plenty of time for questions. I do hope this update has been helpful and has given you a sense of the commitment that we have to actually execute on the goals that came out of the White House conference. None of this work would be possible without collaboration. That is why we are eager to do everything we can to partner with like-minded individuals and organizations like the ones here. That's why we're here. I know we had a panel yesterday moderated by some USDA staff. I'm here this morning, but interacting with us at conferences is certainly not the only opportunity. We have a wonderful, very engaged partnership team at USDA whose whole job it is to look for how we can partner with other organizations to advance our shared goals. So I encourage you, if you don't know them, reach out, contact me, I'll put you in touch with them. I also think it is really important for us collectively to lift up the important work and the successes that we do see around combating food insecurity and advancing nutrition security. So we're trying to up our game around that, including greater use of social media. So please connect with us at usdanutrition.gov, retweet or re-insta or re-whatever you do if you are so inclined. To go back to where I started, we do face some very sobering challenges in this country as it relates to nutrition and diet. But I am, after 30 years of working in this space, I am still very optimistic that we can move forward and make change. In this role, I have the opportunity frequently to travel around the country and see the incredible work that is going on by dedicated folks to advance nutrition security, to engage people of all ages around healthy eating, and to create a more resilient food system. So with the work that this community is doing collectively, I know that we can help move this country to a path towards a healthier future. So again, thank you so much for the opportunity to be here, and I look forward to taking a few questions. I think we still have time.
There's a mic here for all of you who have been anxiously waiting to ask a question. Now's your chance. I will ask a question
All right.
as everyone wakes up their sleeping limbs. To what extent are artificial sweeteners in school foods on your radar? And could you talk a little bit about? I know there was a report by one of our member groups, Center for Science and the Public Interest, that kind of highlighted the changes there and raised some concerns.
Yeah, no, we absolutely are aware that folks have a lot of questions and that many have concerns about non-nutritive sweeteners. And we certainly heard that in multiple forums, including the comments on the proposed school meals rule. We rely on the FDA as the federal experts on food safety and health. And as you probably know, they are considered safe. We also know that, again, that a lot of parents and communities have concerns, and what I would stress is that in the context of the school meals program, it is a local decision what's served, and I know that there are communities that have decided to have their own policies around that, and we look to our partners at the FDA on that, but it is something that we certainly will be continuing to work with them on, and we'll be continuing to monitor as we move forward with trying to reduce added sugars in the school meal program.
Good morning, Karen Ahrens with the Academy of Nutrition and Dietetics. I know that under this administration, there's been, even before the conference to end hunger and improve nutrition and health, government-wide, more breaking down of silos and more working together. I think sometimes schools feel like they're kind of out there on the bleeding edge of trying to reduce sodium, for example. How do you see complementing working with the FDA's efforts to reduce sodium in foods that are produced with the school nutrition efforts and guidelines and standards that are there?
Sorry, so the question is, how do we see the
How are you working with FDA or reaching out with FDA when they're working on trying to work with industry to lower sodium standards, and how this can cross over and help schools meet the nutrition standards.
Yeah, thank you for clarifying that. Yeah, as I said, we have been working very closely with FDA around the school meal standards. I mentioned that we engage with them a lot around the voluntary sodium reductions, and so I think there's a couple pieces there. We really did, as we were developing our proposal, look at what their standards were and sort of how they rolled out over time. We've also been collaborating with them to try to understand what is actually happening in the wider marketplace. And I like a lot of data issues, it's challenging because the data you get tends to lag quite a lot. But I understand. I don't want to speak for FDA, but I understand that they are in the process of trying to get some assessment of kind of where things stand right now, and we will be monitoring that very carefully because we know that one of the things schools are concerned about is sort of how does the food they need look compared to that wider marketplace. So the two things are very closely linked.
Hi, good morning. My name is Rita Stevens. I am a member of DC Central Kitchen in the school foods department. And I'm really proud of how far we've come with the school meals. I think it's amazing even since I was a kid, and I'm 29, so even 15, 20 years ago, it was way, way different. So I'm really happy for that. But of course, there's always room for improvement. And my question is, since working in school foods and working with a diverse population, especially here in DC, are there any programs either put in place now or on the radar for the future about encouraging diversification in the school meals as far as ethnic cuisine and all that?
Yeah, I really appreciate you asking that, and I appreciate you moving into the school meals rules. It's great to see leaders in the early stages of their careers, so that's fantastic. Yeah, so a couple things I'll mention there. We, in the proposed rule that I mentioned for standards, we did actually, in a couple of different ways, make it a little clearer in the regulations that serving, culturally appropriate, ethnic, religiously appropriate foods is completely allowed. We're adding more products that meet those kinds of needs into the food buying guide. I know you know what that is, right? It's the sort of nitty-gritty that helps folks understand foods that can be served. We're also doing work, some of it in collaboration with our partners across USDA, to try to support more local and regional sources of food, which isn't necessarily directly tied to what you're saying, but I think it very much can support it, because presumably if the food in a local community that's produced in a local community may fit well into the kinds of foods and diets that the population is interested in.
Thank you.
Sure.
I'm Jerry Hagstrom from the Hagstrom Report. Where do you now stand on the serving of whole milk in your various programs, and also chocolate milk?
Well, it's a very straightforward answer with whole milk. Our programs are directed to be consistent with the Dietary Guidelines for America, and they're, pretty unequivocally clear that for children, the recommended milk products are low fat and non-fat, and that's what you see reflected in our programs. With respect to flavored milk, as I'm sure you know, we have a proposed rule that put a couple of different options on the table for flavored milk. Currently, flavored milk is permitted in schools at those non-fat or low-fat levels. And again, we took comments on the proposed rule, and we'll be rolling out the final rule soon. I will, I'll leave it at that.
Administrator Long, thank you so much for your remarks. Emily DeMiro with Cargill. Yesterday at this conference, we had quite a bit of conversation around state-level bills banning food additives, and now California has a proposed bill banning color additives in school meals. And I was curious if you had any comments on this, and also if you are hearing anything at FNS from school nutrition directors or any other stakeholders about how this could potentially complicate procurement, or any other feedback that you're hearing.
Yeah, well, again, I'm going to, of course, defer to the FDA in terms of any substantive assessment of the food additives. To answer your question, we have gotten questions about this from school food operators. We're not really going to comment on or take a position one way or another on state legislation. And our role is, however things roll out, we see our role as really trying to inform and support school nutrition operators wherever they are as best we possibly can.
Good morning, Administrator Long. Thank you for all the updates. My name is Wei-Ling Bosley from Massachusetts Department of Youth Services. We serve a very diverse population in Massachusetts. And my question is, how do we balance Buy in America while yesterday we also talked about a certain fruit the seasonal fruit that we have to get it from southern hemisphere of our global market, and also with the youth that we're serving, they are from other culture, and there's certain ingredients that we struggle with buying from America. So how can USDA help in solving those two questions?
Yeah. So, the Buy American provision is a long-standing and very important provision in the school meals program. This administration supports it 100%. But I will note that there has consistently been an exception for things that are truly not available in the United States. And, that we did propose some modifications to the Buy American requirement in the proposed rule, but it would not affect that. So, the example everybody uses is bananas, that, if no one needs to worry that if a product truly is not produced in the United States, it can still be utilized if appropriate for the school meals program.
Thank you.
Thank you. All right, it looks like time is up. Well, thank you so much for giving me the opportunity this morning. Enjoy the rest of the conference. It looks like a great agenda. Thank you.